Hi, this is Dr. Gregory Morse from the Ultimate Foot Store and podiatrist at Queens Medical Center. I'm here today to talk about bunion deformity, which is probably the most common foot problem that I do surgery upon. Now what a bunion is the big toe should be nice and straight, just like this patient right here. The foot is nice and straight, the big toe is lined up behind what we call the metatarsal bone. So on the skeleton, your big toe is lined up behind the metatarsal bone. When you have a bunion deformity, there's a tendon to your big toe that pulls the big toe towards the second toe and starts tightening over time, causing the bone to stick out, that metatarsal bone to stick out, forming a bunion, which is that bone sticking out to the side. As the bone sticks out further and further, and as the big toe drifts towards that second toe, the bunion sticks out and becomes more painful, and people oftentimes develop pain, numbness, or tingling along the side of their foot from the bunion, the big toe bone, rubbing in their shoes, or even barefoot, even rubbing against the ground. Over time, the big toe can cross over to the second toe and you start forming a hammer toe deformity, other pains to the foot, secondary to the big toe, causing pain and irritation to the second toe and the rest of the metatarsal bone. For a bunion, well, there's no way to stop a bunion, but you can slow it down and make it less painful. The first thing is trying to stretch. So every day, stretching your big toe away from the second toe, up and down, basically stretching out that tight tendon between your first and second toes. So doing nice, good stretching of the big toe, up and down, away from that second toe. The second thing is wearing some type of spacer. There's all different types of spacers you can put between the toes. They have like a little bit of silicone padding, so very comfortable. You can slide it between the toes, and it gives a little separation too. That way it holds the toe a little straighter and becomes less painful. So simply sliding on a little spacer pad. It also helps keep that second toe if they're starting to develop a second hammer toe. So a little silicone pad, once again, keeps that toe straight so it's not deviating towards that second toe. Once again, it can't stop a bunion from forming, but it can slow it down and make it more comfortable. There's also a little bunion splints you can wear at nighttime that wrap around the big toe and hold your toes straight. But over time, typically a bunion will get worse. The big toe will continue to drift towards that second toe, and the bone sticks out on the side. Wearing good shoes. Once again, wearing shoes nice and wide, athletic shoes that have a little bit more of a cloth surface right here, so it's not pressing on the bunion. That's also often helpful. Wearing an arch support. Once again, an arch support under the arch right here. By supporting the arch, it helps line up that first bone so the bunion is not deviating so much too. So anything you do to help support that arch with a good shoe, arch support, a good pair of slippers or sandals, especially something like the Bionic sandals, a nice arch support to it, and helps hold the arch up. That helps line the bunion and the first metatarsal bone, helps slow down the bunion and make it less painful. If it gets worse and worse, well, then I eventually do surgery. And when I do surgery, what I do is, yes, I shave down the bunion a little bit, but mostly about realigning the big toe joint. And so what we do when we do surgery, once again, it's mostly the big toe is drifting out towards the second toe and the bone sticks out. So you surgery, yes, typically shave down a little bit of that bony prominence, but more importantly, line the big toe back up. And it's done in an operating room, about an hour-long surgery. We make a small little cut in the bone and put a small little plate or screws to line the big toe and the metatarsal bone up properly. Once it's lined up properly, the bunion is gone. There's no longer pain along the side here, and now it's lined up properly, it won't come back. So once again, if you're starting to develop a bunion, your big toe is drifting towards your second toe, doing your stretches every night, trying to stretch out your big toe away from that second toe, up and down, wearing some type of little device, some little silicone pad or some kind of little spacer between the toes. They also have ones called yoga toes you can wear at nighttime to separate the toe. Wearing a good pair of shoes that don't push on the bunion. Wearing a little arch support, whether inside of a shoe or a nice arch support sandal. That also helps slow down the bunion and make it more comfortable. So once again, it's Dr. Gregory Morse discussing bunions. Thank you very much.